As medical professionals struggle to treat thousands of coronavirus patients, Donald Trump has repeatedly and inaccurately assured the public that vast amounts of vital supplies are readily available or will be provided soon.
We have tremendous numbers of ventilators. The masks, the numbers of masks are incredible.
But the promised supplies aren't getting to many people who need them. One Indiana hospital begged anyone with a sewing machine to start making masks.
It makes you feel less helpless, and it empowers you.
Anheuser-Busch, the world's largest beer maker, is making medical-grade hand sanitizer, as is the much smaller Alabama craft distillery Yellowhammer.
The processes are pretty similar to what we were doing before, so it wasn't a difficult swap.
The global Hanes brand makes underwear and sports clothing. Now, under contract with the government, it's also making masks.
We're a really big cotton apparel manufacturer, anywhere from socks and underwear to T-shirts and sweatshirts. So we can really crank out the goods when we need to. So we expect to make between 50 million and 75 million masks for the federal government.
With assembly lines shut down, the Ford Motor Company is collaborating with other big manufacturers, General Electric and 3M, to produce medical face shields using 3D printers. The companies also hope to adapt auto air filters and other equipment to make critically needed ventilators and respirators. Last weekend, President Trump falsely said the companies were making respirators right now. In fact, full-scale production is months away. Efforts by companies large and small will greatly help in the crisis. But all those efforts take time. And as the pandemic spreads rapidly, time is one thing doctors, nurses, and patients haven't got. Rob Reynolds, Al Jazeera, Los Angeles.
Kimberly Halkett joins us now live from Washington, D.C. Kimberly, as we're seeing these numbers escalate, I believe we're also expecting some new statistical modeling from the White House today. Is there an emerging sense there of the scale of the spread across the country now?
Yeah, according to Dr. Deborah Birx, who is one of the top public health officials coordinating this for the coronavirus task force, on Monday she told reporters Tuesday expect some pretty grim numbers in terms of where this is headed, particularly in the next 2 weeks. This is the data that she's going to share with the public that the governors across the United States have been using to essentially tell their residents to stay home. We have roughly 2/3 of the United States population, about 250 million people, staying at home as a result of this modeling. And the numbers we understand and we expect to hear are not going to be good. Already you mentioned that there are almost 165,000 infections in the United States. And what we expect that this is only going to get higher in the next 2 weeks. What we're hearing is there could be at least 100 to 200,000 deaths in the United States. And that's if the social distancing that is in place right now stays that way in terms of people following it perfectly. So this doesn't paint a very good picture. So this is what we're waiting to hear from the White House. In the midst of all of this, of course, we still have the worst outbreaks in the United States centered around New York City, but we see some big hot spots starting to pop up. Louisiana, Illinois, Michigan. We're preparing here in the United States for some grim weeks ahead.
Kimberly Halkett there for us in Washington, D.C. Thanks very much, Kimberly.